There is some concern that under the ACA, many people, especially healthy young people, will simply not buy insurance until they eventually need it because it'll be cheaper for them just to pay the penalty. Wellpoint sells a lot of insurance to individuals. What are you expecting?
We actually have spent a lot of time looking at consumer segmentation. It's something new for our industry. Really understanding what consumers are looking for, really having marketing groups where we're testing product designs and concepts. If you look at a young, healthy consumer, maybe they need vision care. If you look at our acquisition of 1-800-CONTACTS, how can we start bringing some more value-added products and services into the mix for the young, healthy consumer?
In other words, you may be able to design products that will be sufficiently appealing and, I guess, sufficiently inexpensive to incentivize some of these people to buy insurance anyway.
Starting to look at, when we looked at that, the consumer research, people that aren't consumers of our products and services today have a hard time understanding what do I get for it other than the financial security. Even looking at things like fitness memberships, many different dimensions of that product design, where we have the ability to vary that on the exchange marketplace.
Yeah. There's a related issue here which we've just touched on, which is simply the health of workforces. You cover more people than any other company in the country. What have you learned about what it will take to motivate us Americans to take better care of ourselves?
This is the crux of the issue. How do you engage the consumer? We just recently met with a lot of our large employers, and that's frankly what they're worried about too. So when we think about consumer engagement, we're really trying to look at it. There was a lot of buzz around wellness in years past, and we're trying to pivot that around the concepts of well-being. And technology is going to play a role here. And what we're really trying to do is figure out how do we integrate these pieces together. There's a lot of mobile health apps out there. People download them, but people don't use them. So how do we really engage the consumer in the world they're in? Many people control their life from their smartphone today. How do we make it simple? We're trying to change the paradigm, looking at it from a well-being perspective, but getting consumers to realize their health is an asset. And what are all the pieces that they need to really manage their health as an asset and understand the implications of the decisions we make as individuals on our health downstream. And so I think there's a lot of things we're focusing on to help that. Also, another application around accessing health care. Sometimes it's challenging, so access to health care is a key focus for us. Telemedicine's been around for a long time. That's another area we're looking at. How do I bring the doctor to the consumer, where the patient is? Part of why we're trying to address affordability, access, and the consumer experience is we really believe these pieces have to come together to keep and engage the consumer in their health care.